All right, I think we'll get started. Welcome everybody to the ARPA Advisory Committee meeting for Tuesday, March 21st. As always, the meeting of the ARPA Advisory Transformational Committee are public meetings as defined by the Connecticut Freedom of Information Act and should follow these guidelines. As this public meeting is held virtually, it will be recorded and made available to view on the DDS website. Committee members must make a good faith effort to state their name and title, if applicable, each time they speak during the meeting. If a committee member would like to speak, please raise your hand and one of the co-chairs will acknowledge you. There is no public comment portion to this meeting. Members of the public are able to join, watch, and listen only. All right. The approval of the minutes of 2/21/2023. Are there any comments to begin with? There are questions? Is there a motion to approve the minutes?
Moved.
Second.
Michael and Shannon. All in favor? Aye. Any opposed? Okay, the minutes. Okay, next we're moving to the update of the committee co-chairs. I believe, Peter, you're first with the Residential Transformational Committee.
Our committee did not meet this past week. We meet again in 2 weeks. We're I'm trying to think if there's anything that we talked about that needed to be addressed. Not that I know of. So our committee did not meet this week or this past week.
All right, with the Day Transformational Committee, our last meeting that was held, we had the Seln Commission participate in our meeting. We had two presenters. One was Suzanne Fries and the other was Wesley Anderson from the State Employment Leadership Network. And that's a network of 25 member states. And they came they were developed because there was a plateau and decline in integrated employment outcomes and increases in facility-based work in the late 1990s and early 2000s. Over the last 10 years, they've seen increases in integrated employment services, but data has also shown that non-work settings have continued to grow. They talked a lot about states are considering a shift in what they consider a successful program transformational path, and largely states are leaning towards the individual employment model. States are at the point of considering what really needs to be offered, what is possible, and what can be sustained differently than in any time in the last 10 years. So the big point I wanted to make was if an individual, if they want a job, they say they want a job. They don't say they want a service. It's up to the provider to decide how the individual gets the job. We also had a presentation by McDowell, and they talked about their surveys. They talked about the videos that they're filming. They're actually started the filming today, I believe. And they talked about the bi-monthly newsletter that was sent out to the individuals and families, providers, and DDS staff. And I believe that's all been sent out already. So that's it on the day program side. If anybody has any questions. All right, the DDS engagement. Peter, I believe that's you again.
So the DDH engagement had McDowell attend, the communications consultant, and they went over the communications plan and that was developed. And they also went through the newsletter that was sent out. And so now they're looking at, they're doing now, they've been doing forums this month for case managers. And I'll be attending, I think, the next one next week with the case managers to give them more information regarding ARPA. And they're looking at setting up smaller groups within the region to discuss ARPA transition plans and those that, especially when this all gets started, those that go, case managers that have been involved in those plans to then start working with the other case managers to get them know what's being out there, what's being offered. So they're trying to set that up as well. So that's what they're been up to.
All right, thank you, Peter. Shannon or Greg, the Individual and Family Engagement Committee?
Yes, we met since this last advisory meeting. We've had 2 meetings, and also sort of similarly, McDowell attended the meeting, did a review for families and individuals. The committee around the newsletter reviewed their communication plan, which broke down activities they're involved in and kind of the roles of the folks who are participating in those activities. Most of our activity has been around approving a program description template that will outline what our program, our services are, that is simple, describing the service. It's not a process document, but a document that explains what each service is for individuals and families, including challenges and benefits, and what is available to families through each of those services. We also have a draft of IHS within that template, and are working now on a CCH draft, and we'll continue to work through all the services that are available and try and have a fact sheet put together for each of those. And starting with the 7 that correspond with the videos that McDowell is in process of recording right now. That's, I think, generally been our activity for the last 2 meetings.
All right, thank you, Greg. Any questions for any of the committees? Win. I believe you're on mute.
Yep, thank you. Whenever it's the ARC of Connecticut. Greg, are the end results for the videos going to be shown to the entire collection of system stakeholders? Is that the goal?
We're still working through the best processes by which we can make sure that the videos don't get shelved somewhere and no one watches them, which is a concern. So the idea of we're working with McDowell on how best to present them, get them out through various means, through social media, not just our website, and so that they can be shown around. I'm pretty sure once they're done, they'll be shown. I don't want to assume, but I assume they'll be shown to all of us on committees as well. The bigger challenge is making sure that they're out for every family and they don't have to go looking for them, but that they are readily available and that people know about it, which is part of our committee's recommendations will be how best to do that and work with our communications to get stuff out effectively.
Thank you.
Any other questions? Barry.
So thank you, Barry Simon, Oak Hill. So I'm glad McDowell is getting around to all the committees. I know they came to us probably about a month ago And at that point, it was kind of we're gonna be putting together a newsletter. We've changed the acronym. But are they gonna come back to us to kind of, as the advisory kind of committee, to know like what they're doing and how they're putting some of this stuff together?
Yeah, they would have run this week, but the consultant was on vacation, so they'll be here on the next round. The next meeting we have.
Okay. And then a follow-up question, I guess, for in particular the residential committee. I know that there were a number of presentations done about alternative residential options, and I don't know whether, I know that I believe we were told that new kinds of residential options would be considered for round 2 or phase 2, because it was unclear what the reimbursement would be for some of those kinds of services. So is that starting to be discussed in that residential committee, or when do newer, more newer models of service options that currently the rates haven't been clarified, when does that kind of stuff start to happen?
So, one of the things we're looking at, and I think we've said this before, it's like we're working through whatever those new programs are. They have to, how do they match with our waiver definition and stuff? So if there's a new service that needs to come through, it would need to fit within our current waiver. Otherwise, we would need to go through the amendment process. And so at this point, we've been meeting with Deloitte in terms of the DDS analysis and review. That's being worked through. We're looking at some of the issues that are going to be addressed through the ARPA initiative, other issues that DDS should be looking at the same time, but outside of the ARPA piece, because there's other things that are happening. So we're kind of looking at that, and so we're waiting for that to come through and work through that. I will say that, we haven't found a whole lot of new stuff. I mean, I know we've got the ACT program that's out there, but we haven't seen a whole lot of new stuff. And we've gone through different states and all that stuff. We've seen pockets of stuff, but a lot of stuff we're doing is like almost addition to what we're doing versus something that's totally new. But as a lot of that stuff we're going to be looking at as we get through the Deloitte plan and work through that.
All right, thank you.
Keith Lavalette, DDS, Shannon.
Hi, this is Shannon Jacobino, DDS Ombudsperson. To Barry's first question, the Individual and Family Engagement Committee has put both Deloitte and McDowell on our agenda for every meeting to give updates. And, there might not always be an update, but I think having them there allows them to speak in a meeting if we need them to. And it also allows, all of us to sort of be on the same page. So I'm recommending that maybe we do the same thing for the advisory committee meeting.
This is Keith Lavalette at DDS. They've been added as optional to this meeting too. So
Great.
It just happens. McDowell's on vacation this week, so they weren't able to attend.
And then to Barry's second question, as far as the opportunity to explore additional supports, will the supports all be sort of defined by DDS, or do providers have an opportunity to present plans that might not be something that DDS is defining already, so I'm trying to wrap my head around how that will work. So if a provider has a novel idea for how to meet a need that sort of fits within the funding structures. Is that something that is a possibility?
This is Peter Mason. Yeah, and in fact, we're sending out something by the end of the week, I think, or beginning of next week, regarding the plans and all that stuff. And we are trying to emphasize creativity. So if people have something that they're looking at establishing, they should bring it forward to us. Now, once again, depending on how it works with the waiver, how that all works, we would have to see whether it fits within our current waiver. But we're trying to look at creative stuff from providers. So if they've come up with something, absolutely, they should be bringing that forward and discussing that with DDS.
Keith Lavalette, DDS. Michael?
Michael Beloff, parent and agency board member. And I just want to say, Peter, and I sorry if I missed this, but I think also asking if we're getting the family input, families don't necessarily understand how the waiver program works and what the restrictions are. But I think if you ask families how they would like their family members to be supported in a less restrictive environment than a group home, we might find that a lot of what they describe, it'd be wonderful if it actually fits within how our waivers are written so that those could be accommodated. And we may be doing some of these either families might be doing it privately or doing it with agencies or kind of skirting around some of the issues. But when you look at the way that families might imagine their loved ones being supported residentially outside of a traditional group environment, you would find things like home shares, you would find things like supported living, you would find things like similar to iDash, where there's perhaps a small community of individuals within a larger community, so it's not considered segregated housing. You're going to find lots of ideas that may be able to be done. They just don't know what to call it. They just know this is what we want. They don't really care what we call it, as long as it can be supported either through the current waivers or through a modified amendment if that's necessary at all. But I think it's, one of the challenges I think we have is that for those of us who work in the system, we have one way of thinking about it and calling it, and the general public doesn't know anything about any of that. They just know this would make sense for my kid. And however we then figure out the rules and regulations that need to be done to protect it that families don't necessarily understand or appreciate yet, that's really what they're looking for. And I'm hoping that that's kind of the path that we're taking for these accommodations. Granted, there may be things that parents can't imagine that might work better for them that someone else came up with, and that'd be a great overlay. But I think parents sort of instinctively understand what kind of supports their family member might need. And if that can be accommodated, that would be fabulous.
This is Peter Mason. We've tried to do our outreach. We've had input sessions from families. We had surveys and trying to get that information from families. Didn't matter what they call it. They just would. So we have tried to get that input. I don't know if I've heard these great suggestions or all that stuff, but we have put it out there. And the hard part is that if they're working with their provider, that's easy. If they have this in their head, they want to do something separate, then they work with their case manager. It's how do we get that information passed on to us? We can tell people, let us know if you have these ideas. Whether it actually gets passed on or not, I can't guarantee that. So, we've tried to do our outreach as much as possible.
Michael Beloff, a parent and agency board member. Just one last thing. I think one disconnect might be is if we're only dealing with families that have residential budgets, we're missing out on a whole load of information from families who don't have residential yet. Because they don't have residential funding, they have no idea what the system looks like or how it works. And they may have been reluctant or unaware that they could contribute ideas that they would imagine for their kids. And I wonder if we know how many of those families we've connected with rather than families who are already in the system.
I know when we put out this is Peter Mason, when we put out the call for the forums and stuff, we didn't say whether you had residential budget or not. It's like, give us your opinion. So, and while we may have the name of who attended, we tried to keep it so that we weren't keeping tabs on everybody. It's like it was supposed to be an anonymous or piece so that they could present it and not have to worry about us. So for us to go back and track down, I don't know if that's, I don't know how comfortable I'd be, and they had the opportunity is what I can say. Shannon, your hands up.
So, I mean, I can tell you from my experience being out in the community, talking to families, that everything that Michael just said is stuff that we've heard over and over and over again. And I'm sure Wynn would back me up on that. I think that when people, I think another obstacle is being able to, I don't think our system is currently designed to work with people and to meet them where they're at. And so if a family goes to a case manager with an idea that doesn't fit within the existing structure, it really sort of depends on who the case manager is to see how far they're going to get with that idea and how much creativity and flexibility the system is going to be able to have in working with people where they're at. And so I've seen that happen firsthand, where the tendency is when somebody's kind of going outside the box is to try to bring them back into the box, right?
Mm-hmm.
And the other obstacle is really sort of understanding how all of the different resources and funding that is available to people, how that can all work together to help someone meet like a real plan, individual plan. And, for instance, how can DDS funding and community first choice funding work together for somebody who's ready to make that move and has some ideas about how they want to do it? I don't really think our system is set up for case managers to be able to currently to figure out how to make those things work. I mean, there are some people in the system who do that, but it's not really the norm. And so I don't really think you're going to be getting a lot of that feedback from case managers, because I don't really think they entertain much of that with people when it comes up.
This is Peter Mason. I totally agree. I don't know what mechanism we could have to receive that and be able to work through those issues. In terms of how the funding and all that stuff, I guess I would ask that the individual and family engagement committee take a look at that. And is there something that can be set up, or presented in such a way, whether it's a one-page whatever, that can describe, the different sources and all that kind of stuff. That would probably be a good project for the individual and family engagement committee.
This is Shannon Giacovino, DDS Ombudsperson. One more thing on that point. I mean, one suggestion I have is making an investment in marketing individual support brokers, expanding that pool and marketing that, because where I've seen people be able to actually put together a plan and to work with DDS on putting together a plan that is outside the box, it's when an individual, an independent support broker has been involved in helping to try to put all of those pieces together. I that's where I've seen the success. And so I think that that's a really important role, especially as we're moving forward on looking at new types of supports for people. Is you have to have somebody whose job it is to really try to drill down and figure all this stuff out.
That's a good point. Thanks.
Keith Lavalette, DDS. Wynn, you have a question?
Yeah, thank you. Wynn Everts, the ARC of Connecticut. I'm just wondering, along the lines of this discussion, whether I'm wondering whether the changes that have been made to the waivers, and I'm not asking, I think that this whole moving on thing is basically trying to develop modes of support that currently aren't there. If there's a way to make the billing codes more flexible, like what was piloted in I think the 2019 type of time frame, where you blurred employment things with residential services for people that had wanted a mix during the day. They were possibly of retirement age and things like that. If we could get there, I think the creativity goes up pretty dramatically. So I don't know whether that blended supports was piloted to younger people as well as older people and what the result was, but I think that that's kind of the flexibility I think that moving on is looking for, and it sort of just depends upon your barriers in terms of sort of what's necessary.
This is Peter Mason. Yeah, the blended supports is still happening. Individuals who are identified. It wasn't limited to anybody. It was whoever wanted to do it. And so maybe what we can do is I'm going to find out who would that be, come back and give us a presentation on the blended supports. I agree with you. I've said this a number of times. I think blended supports is a big piece of the puzzle for individuals and families, so that they get one lump sum and they can do whatever they want with it. Once again, it's that's not how the system operates, and how it's looked at budget wise is not in that kind of mode. So there's a lot of hurdles that are out there that need to get addressed or get overcome. But I think if you look at other states, most states have you can use your money within the day or the res. There's no limit to be in certain funds. It's not something that's Connecticut has embraced at this point.
Keith Lavalette, DDS. Barry?
Barry Simon O'Kill. Thanks, Peter, for saying that, because I know that's been one of my kind of bugaboos, that if there were a way to give us the ability to provide blended service or collect blended rates for blended services, it would provide a greater flexibility in allowing us to integrate day programming into the community in ways that people don't have to get a 6 or an 8 hour chunk of day programming, that they could actually get 2 hours, 4 hours, 3 hours, whatever, throughout the day, that in a way that it naturally occurs in the community. And so, our openness and our ability to modernize the rates in ways that match modernization of the services would be a great thing. And I know that that's, a big, hill kind of thing. The second thing, I just wanted to also go back to Shannon's point, which I know we have a number of times brought up the challenges with case management as a level within the system, and how it, if it is not transformed and modernized, also just creates challenges. And I know we're not here to talk about transforming or modernizing the state system, but for the record, that is a problematic layer within transformation for the system. So,
Well, I don't know if I would call it problematic. I would say that there are some issues there. I don't know if I would call it problematic. This is Peter Mason, by the way. But to go to the blended supports, just being here and all that, I think if that change is to happen, it's probably going to have to come from outside of the department and get moved through the system from outside of the department because there's a lot of entrenchment in terms of how the budget should be set up and how it works. And so I think it's something that needs to be brought from elsewhere. I know we've tried on our end, but just to give you a heads up.
fair enough.
All right, seeing no more questions, moving on to the next agenda item. Peter, you're on again. Update on transformational initiatives.
So, just to give you some updates, and one of the things, this is Peter Mason, just to piggyback, our public programs are looking at how they fit into this transformation system and how that they can assist. And I know that they've been working on that. So they're working through how that they can be part of this and get individuals who are in their programs.
The attorney told me that both my seller's attorney told me.
Who's that? All right, sorry. Anyways, they are going in, they're trying to come up with their own plan in terms of transformation. So just so that you know that they are reviewing that. So one of the things that we've done, and there'll be a letter going out to providers, and there's a public hearing after listening to concerns of providers and some of the committees. And helping to move this initiative forward. What we've done is we've submitted to, or we're in the process of submitting to CMS an amendment to our Appendix K. The American Relief Funds all go through our Center for Medicaid and Medicaid Services. And so we had approval for that. But some of these unique things that we're doing in terms of incentives had to get done in an approval format that was different than we've had before, and that they had called that this Appendix K. And so we had put the original format in once we realized that a couple of years ago. We're now in the process of amending that, and we are under a little time period because we have to amend this before the public health emergency ends, and that public health emergency ends in May. And so we tried to get together. We had been working with CMS initially, saying we had these number of these initiatives we were looking at doing and trying to figure out what the vehicle for what that was. And at that point, they didn't have a good system for it. So we thought we could do that through what we call our quarterly report that we do on a quarterly report to CMS. And initially they were in support of that. And then in January, they came back and said, no, it has to be done through this Appendix K. And that's a big deal. And so we had to switch things around, work through some of the language issues. And what needs to be done now is that there's a public comment period, which we're into right now. And then there'll be a public hearing through the legislature. Once that's done and that's approved through the legislatures, then we can submit it to CMS. And that all has to be done by May 13th, which is an extremely short time period. So, but we've been working through that, trying to get this done, and trying to assist in terms of this initiative. And so we've come up with a number of amendments, and I'll go through those right now. We feel that these are right in line with being eligible with CMS, but there's no guarantee until we get the final approval from them. And CMS has 90 days from May to approve this. So once we submit it, then they'll have 90 days to submit it, up to 90 days. They're telling us it won't be as long, but you never know. So we're telling everybody this is what it is. We're thinking that it's going to be these. We're hoping there's going to be these, but we won't know for sure until we get the exact approval. So with that caveat said, what we're doing at this point is we've added some incentives. So one of the things that we heard is from providers had to do with the cost to build these plans or to make these plans. So we've put in an outcome payment for providers that if they submit a plan and that plan gets approved by DDS, if it's for one program in their agency, they would get an outcome payment of $7,500. If it's for two agencies in their program, it would be $12,500. And if it's for three or more programs, or it's an agency-wide restructuring plan, they would get an outcome payment of $17,500. So that's just to submit the plan. So that we're trying to make it so that we're giving an incentive for providers to submit their plan and work on it in a way that is meaningful and will be in the best interest of the individuals they support. We're also looking at, one of the things that we heard is we have an outcome payment for residential when an individual transitions to a non-congregate setting. But there was nothing there for day. So this amendment would, if it's approved, would add an outcome payment for a move out of a day congregate setting into a non-congregate setting. And that would be for a $15,000 outcome payment. We're also looking at if you have an objective in your plan that you want to achieve one of 4 items that we've identified. If you achieve that, you would get an incentive payment of $33,000. So for example, if you're looking at moving individuals out of a CLA and then restructuring that CLA for individuals who have more specialized either medical or behavioral clinical needs, and you do all that, at the end of that, we would then give an outcome payment of $33,000. So the 4 items we have is transitioning a CLA or CRS into a providing more complex medical or behavioral needs. Doing the same for a day program. So those that have, if you're restructuring a day program for more specialized or complex needs. If you're restructuring a day program to provide new supports that focus on employment-based services. And then the 4th one is if you're ending a sub-minimum wage arrangement for individuals. So if you put in your plan one of these 4 goals, and you meet those objectives, at that point you would then get an incentive of $33,000. Let's see. One of the other places that we're looking at is we're trying to increase the participation of providers to complete the National Core Indicator survey that they do for the workforce. And so we'll have an incentive payment if a provider does that, that we would then pay $3,000 for each survey done on a person, up to a maximum of $30,000. That's survey. That's not right. If it's a workforce survey, sorry, it'd be $3,000 if they completed the workforce survey. Sorry about that. An incentive, we're looking at incentivizing training as well. And so if a provider is looking at providing training their staff for more employment-based certification programs under ACRES or customized employment, we would then provide an incentive payment of $3,000 per person, and that would be for a maximum of $30,000. If someone's looking at it for assistive technology, that was an assistive technology. Once again, we'd be doing the same thing, incentive of $3,000 and a maximum of $30,000. So I don't know if anybody has, that's a lot of information. But I don't know if you want any comments or questions about that.
This is Keith Lavalette, DDS. I'm not quite sure if you mentioned this or not, Peter, but if CMS approves the revised Appendix K, it would be retro to February 1st. And providers that submit a plan in phase 1 would also be eligible for these incentives.
That's right. Thank you. Thank you for mentioning that. Katie?
I just have to, it's Katie Bansaff Star. I know the answer, but I have to ask. This won't be available to those agencies that were forward thinking and did several of these items in the past, like eliminated their sub-minimum wage certificate and
No, it would have to be after.
Yep. Staff.
Yep.
I knew the answer, had to ask.
Yeah, it would. I think the date is, I think it's March, sometime in March. So anything at the beginning of March forward. Sorry. Barry?
So thanks. Oh, so my first question was going to be Katie's question. So much for being forward thinking and doing the right thing. Second,
Katie from Star, I just have to interrupt to just say, this is where we're trying to encourage creativity. And this is where we feel punished for creativity.
So incentivizes the wrong behavior. So the question I had was, in developing those incentives, are there going to be incentives to help agencies that are on this trip that may have already done things or whatever, that to put in, and fund like electronic health records that are going to allow us to, submit data to either you or to others. Right now, the way the technology funding comes out, it's always such a short time frame that you don't have the ability to go out to RFP, to do all the kinds of things on long-term technology kinds of things that are needed. So I don't know if there's a way to incentivize, those kinds of investments for agencies as we go forward.
This is Peter Mason. I guess that is why we have the technology fund. So if you're saying you don't, I'm not too sure what timelines you're talking about. I know that this recent one was extended to.
Yep. So with that extension, it opens up some possibilities, but just as a way of going, I mean, the problem always is that when you're given such tight timeframes, it doesn't allow you to do the planning and the things that you need to do. And you don't know about the extension until you've already made a decision to do something else because you didn't have the time to do the things that take time. So,
I hear you.
So if there's a way to think about the incentives of what you're wanting in the system to make the system stronger and be able to be more, qualitative in what it's doing, submitting and collecting data that would help us to manage in a more proactive way, all those kinds of things. You know, you might be developing some of your incentives to be doing those kinds of things as you're developing these incentives.
Yeah, and unfortunately, that's not going to be available for this because we're, as I said, everything's a tight timeline with this thing. So these are the incentives that we've put forward. You know, the issue, I hear you in terms of the IT piece of it. You know, we're trying to work through a number of criteria that we have to make sure we follow for getting this money out and paid and used. And sometimes, you know, we're not doing it in the most planful manner, I would have to say, you know, but we are trying to get the money out as much as we can. So this has not been an easy exercise, and anybody who says you can't spend all this money is a tough problem to have. Well, sometimes it's just as tough to spend money as it is to cut. So just so you know, trying to get this money out, and we're trying to do our best.
This is Keith Lavalette, DDS. Katie, do you have another question?
Sorry, no.
Okay.
Anybody
Keith-
else have any? Anybody else have any questions? Okay, I got some more to go. Hold on. We have Deloitte on here, so I'm not going to go into some of this, but they can talk about, they've had some open sessions and they've had providers going in there and working through those issues. One of the things that we're waiting to see is the transformation options. We're working working through that to how to get that done and done in an efficient manner. Let's see, we did that, the videos. We had our rewarding work to redesign their website, and which was for individuals who have self-hired their staff and are looking for staff. That was supposed to start on March 1st, and that was delayed. There's been a little glitch in terms of our IT department. We think we have that resolved, so we're hoping to get that up as soon as possible. The old design is still up there, and there are some additional options that we have, but the full scope of the website's not available yet. Hopefully that will be soon. We have 4 notice of opportunity grants for assistive technology. We have 34 applications that are for individuals and families. We have 7 applications that are provider based. We have 1 for employment that we just sent out recently for AT and an employment. And then there's AT trainings that we're looking at as well. So we're putting that out. We finally have got our AT RFP. This was just issued earlier this week. This is the request for proposal for companies who will come in and we will hire companies to either do the whole state or a section of the state, a region, where they will be responsible for the assessment and training and purchasing of the equipment. So if anybody is looking for assistive technology, they would do the assessment. They would then submit what equipment they would need. That would go to Pratt. Once that's gone through Pratt, it would be the responsibility of this company to order this and to install it. and then train staff. So we're trying to get this so that this becomes a much easier process for individuals to get assistive technology training. And the last thing is we have our non-project based supported housing grant. As I mentioned before, we had supportive housing opportunities have come up, and these were project based, so they were from they built it from the ground up. This is non-project based, so these are already existing housing complexes that we're trying to establish with supportive housing programs in that. So, and we had multiple submissions, which is very positive. And so we look forward to see what those will look like, and hopefully we can get some of those off the ground. And that is my update.
Thank you, Peter. Keith Lavalette, DDS. Any questions for Peter? All right, seeing none. Next we have Betsy from Deloitte to give an update on the transformational plans.
Great.
Go ahead, Betsy.
Hello, this is Betsy Bella from Deloitte. As Peter noted, we have continued holding technical assistance office hours. In the last few weeks, they have been less popular, but that's because we've continued one-on-one outreach and technical assistance to folks who are finalizing their plans. DDS has received 3 plans, 2 from the West region and 1 from South. This includes 2 plans focused on day transitions and 2 on residential. So that means 1 provider is doing both. So at this stage, we're seeing fairly different plans from each. All note that this is either work they already plan to do, that the incentives are making easier, or that it's support individuals and families have been asking for that can now become more feasible. 2 providers flagged staffing challenges as part of their plan. 1 noted using incentives to bump salaries and attract more staff. Both of the day plans did note an expectation that the transitions will get others excited about pursuing employment and individualized employment. Employment or individualized, especially because, as I think folks know, often you can't immediately jump someone to full-time ISC support. And so they'd still be participating in some of the other programs, have a chance to talk to their peers there and get other people thinking about their opportunities. And then across these plans, some are focused on many individuals and settings, and others a little more focused. So about the day transition in West, it's group day and individualized day with a plan to transition 15 people, and then maintaining the existing offerings for fewer participants. Overall, sort of long-term, they're looking to transition from large group day to more individualized, particularly in support employment. They've already identified individuals who are participating in their existing programs who are interested in transitioning and are looking forward to, as they continue to dialogue with existing participants and families, to offer the option to more people and find more folks who want to transition. Some things we just sort of wanted to highlight is they're looking into travel training and benefits coordination to support people along this process, in addition to the CERT supports. And this provider is looking to recruit 2 job developers and 5 job coaches as part of their moving honor step work. They're going to have them complete customized employment training when it's available again through the state. Even though they're not necessarily going to be providing customized employment, they will be able to use those components. Residential transition in West, and this is a different provider. A big transition with 11 CRS settings included. Some of the settings are going to close. Some they're going to bring in people off the wait list or with greater behavioral medical needs. And they're going to adjust staffing based on the needs of specific individuals, right? They don't know who that's going to be yet. It includes many individuals, including several who had previously expressed interest in greater independence, and others where, as they started to talk about this, became interested. They are recruiting additional staff, including additional management staff, because given the scale of this transformation, they really need that to help support it. This provider does not currently provide remote supports, so they are getting qualified up to do that. And they're also looking to use assistive technology, including developing a test kitchen and living area for people where they can learn about and test options as they prepare to transition. Something that people have sort of raised is like, well, how does this work with that possibility of moving back within 60 days? And they're going to meet with folks formally every 2 weeks during that first 60 days to provide support. And also that's an opportunity if people want to move back, but they can express that desire at any time. They've already been having conversations and meetings. They plan to continue them. And to that question of sort of how do you help people stay connected, they've got plans to support both people who are transitioning and not transitioning to stay connected where they want to. There's also people who are transitioning because they don't like their housemates. They don't need to stay connected to them. The individuals already, interestingly about this plan is everyone already either has a rent subsidy or has enough income to cover rent on their own. And so there's no concerns there as people move and shift. Now, a provider who's put forward a residential end day transition, who's in South. For residential, they're just focusing on one CLA. And here they are looking at a transition home model. Now, this is a great example of what folks were talking about earlier around this idea of if providers want to put forward a new model, do something that's maybe not directly in the box, they can have conversations with DDS. So this was discussed with DDS previously, approved in other situations, and then has been integrated into their plan. Now moving to the transition house in itself is not eligible for the incentives, but it's a part of their plan in terms of how people will then move to IHS. The transition home is categorized as a CLA. And so as they're working forward towards it, they are going to close the CLA that people are in right now. And there are some folks in that home that are not interested in moving to IHS ultimately, but they're going to move into other CLAs that the provider operates. So the transition house model, if people haven't heard some of it, what it is sort of a individual apartments within a building. And there is full-time staffing, but a lot of it's actually provided through remote monitoring from someone who's on site. And so this gets people familiar with the idea, more comfortable with how to pursue that, while they still have that safety net of someone is on site. I'll pause. I see Peter's hand is up.
So just so people know, this was presented to DDS a couple years ago, and with the option of vacating a house and moving to this new setting. And the new setting has, I believe, 5 single apartments that are around the middle section. And in the middle section is the support staff and a common area. And what individuals will do is they'll move into these settings, and initially it will be like a group home, but then slowly they'll start transitioning them to living on their own and providing less supports. And the idea then is once they feel comfortable, the family feels comfortable, they'll then transition them to IHS. They'll then backfill that with another person to go into that house. Now, that all sounds great. And this is where, the state bureaucracy comes into play, because it took us about a year to get this through with DSS. But out of perseverance, we worked through that. And so we did get approval for it. So with these, unfortunately, when you're dealing with 2 agencies, it's bad enough with just 1 agency, but when you have 2 agencies, it takes even longer. But it's not like these things can't be done. It just needs to have a lot of perseverance and a lot of data to make sure people understand how this will benefit the individuals and the families.
Let's see, Bella. I'll wrap up talking about this and then we can pop back to.
I think,
Barry.
one more thing I see.
Barry's got a
Barry's
question.
hands.
Yeah, so Peter, using that as an example, I know I proposed that model, 9 years ago, and it was, not able to happen 9 years ago, but clearly it's able to happen now. So how does that get back out to the community so that we can replicate the, whatever payment model you figured out to make it work? because, you know, after having pounded that model for 2 years, finally giving up, clearly it's able to happen. So how can providers know that they can come back with proposals that were defeated or not able to happen, you know, 9 or 10 years ago?
Yeah, so this is Peter Mason. One of the things that we were trying to do is wait to see this house up and running before we start saying, oh yeah, we can do this, because there's still going to be um, work throughs in terms of what is the transition house, and what's the is there a limit on how long somebody can stay? Is there all this stuff is, you know, conceptual until it actually gets built. And while I while we finished up with DSS, there's still going to be, as one house goes and another one opens up, how that transfer happens. In this particular case, the way this model is that those individuals would still be, since they're a CLA, they'd still be receiving their CLA amounts. And then as they start transitioning out, then we would start looking at transitioning into IHS and then different authorizations and stuff like that. But that's this, I don't know what happened 9 years ago, Barry, but this one took us forever. And I'm not saying it's easy, but we do.
I know. I mean, I tried and pushed and pushed and pushed, you know, and then, you know, finally gave up.
Yeah, and it was working through, you know, issues such as, what do you mean? Each unit's going to have their own furnace? That's a waste of money. Each unit's going to have their own
You know, yeah.
you know,
So
stove, all that kind of stuff. We had to work through all that stuff. And what it came down to is, and the provider was really good. We ended up having to go through this, and I literally had to go through the savings part of this. And it was going to cost, it would have cost DSS, I think, $50,000 more over a 10-year period. And the way the provider explained it, DDS would be saving $2 million. And until I could get them that piece of money, it got stuck. Once I could actually show what the savings were, then all of a sudden it go, oh, sure, go ahead. So it's not an easy process, and you know, but
I know.
it's something that, you know, now that we've got it down, and once we can get this thing open, I think then you'll be able to see it a little bit easier at that point. So that's the only reason why we haven't advertised this as much.
All right. Yeah. Because like I said, well, you know, I mean, these are models that we ran in DMIS, you know, 20 years ago. So we know how to do it. We just want to do it. So,
and if you put it as part of your transition plan, Barry, I'm sure we would take a look at it.
okay. Sounds good.
Okay.
Okay, Betsy Vella from Deloitte. And some things that they're going to include while people are working through that model are classes, how people prepare, similar to what we saw in some of the other plans, right? So stranger danger, healthy cooking, travel training. And they do have plans for peer mentorship, helping once folks have moved from transition home into IHS, they can then mentor people who are moving through it to, you know, continue staying in the model of the movement. On the day side, they're targeting a group supporter employment and group day supports programs. The plan is to maintain for fewer participants and potentially restructure for individuals with significant medical or behavioral needs. They're moving to transitional employment services and ISE or other independent models. And this provider is actually adding project search. There are some folks who are not interested in working in more of these sort of the group day supports who will move to individualized day supports. And they're developing hubs to build work skills that are more focused on people with greater support needs that will also serve as a drop-in setting. So they are also going to focus on relationship building and employment supports to build that more sustainable natural support over time. So as you can see, we really do have quite a range, even in just a few plans from a few providers. And we look forward to seeing more as they come in. And this is just at the beginning.
So this is Peter Mason. So just one of the things that this is spurred on, has to do with the issue of individuals not wanting to work outside in the community, but still wanting to work, and how you can do that. And one of the things that they were proposing was whether we need to look at a DSO vocational model and a DSO non-vocational model. So whether we do that or not, it just started spurring some of those conversations. And that's the kind of stuff that, we hope we'll see with the providers, is that they'll, not everything's going to be accepted, but there'll be those things that we will be able to move forward with. And so, the more creative, the more it can kind of push DDS into those creative minds.
This is Betsy Bella from Deloitte, and building on what Peter's saying about creativity and harkening back to what Michael was saying earlier about hearing from families. Providers should be discussing the possibilities and the plans with individuals and families. And so there is this opportunity, as they might hear some more creative, interesting ideas, for those to then be integrated into plans. And that's a great way for that to come to DDS.
Keith Lavalette, DDS. Any questions for Betsy?
This is Peter
Seeing-
Mason. Betsy, oh, I'm sorry.
Go ahead, Peter. Go ahead.
Betsy, with all those open sessions and one-on-one sessions, it seems like we have a number of providers that are looking to be presenting plans at this point. Do you have a rough number of what we're looking at just in this initial phase?
This is Betsy Bella from Deloitte. I think we should expect some more in the next 2 weeks. I would say probably at least 3 more. There are some folks who are just sort of, since there isn't a hard cutoff, right? You can move in later in the process, and that's not about waiting for phase 2. That's just about sort of how their planning is emerging. And then most of the questions we've received in these sessions have been really focused on sort of the budget template and the template itself, or understanding the initiatives or the incentives being offered. And so as part of phase 2, since it's for the broader audience, there will be more written guidance around some of those elements, especially with the pending Appendix K updates. So hopefully people find that useful, and we'll of course continue our sessions.
Yeah, and we're excited that we got the 2. We definitely want a whole lot more. But it also has allowed us now to those agencies that have been working through the templates and the budget thing to come back with us and say, why do we do this? Why do we do that? So we're looking at making some, revisions so that we have, something a little bit more usable for providers. It was something that we couldn't do until actually people started using it, that we needed to have people who go through, now this doesn't make sense, this does. So.
Okay, thank you, Betsy.
Thank you.
The next agenda item is issues the advisory committee identified at previous meetings. And Peter, we didn't get to talk about this, but I'm not quite sure if there's an update in this category.
Well, I was supposed to discuss with the provider. Let me see, where is that? Hold on, where do we go? I was supposed to discuss the whole issue of shared housing, and so if people don't mind, I'll talk about that. We had talked about this at our residential committee meeting, and people were really interested in terms of shared living. We have an issue with the shared living in terms of the mechanics of it, and we're finding that we want to make sure that we get it right. And we have some that are out there, and it just hasn't taken off, and then some of that's because we're not comfortable on how some of these things have been developed that may be more of a Department of Labor issue in terms of how much staffing and how much supports are provided. So one of the things that we're trying to do is to go back and do more research in terms of shared living and how other states do it. So we have a better idea of what that is so that we can communicate it to people. So we're looking at getting that off the ground and hopefully have something that we can present sometime over the summer. In the meantime, I broke it up and developed this term called shared housing. And because there's two pieces to this, shared living may include an individual, a couple of individuals, but doesn't necessarily have to. It's based around the person and what that person can do. Shared housing gets confused with some people in terms of the parent wants to buy a house and everybody's going to live there, so that's shared living. So that's not really what we consider shared living. So that's why we need to come up with a better definition of it. So what I presented to the residential committee was more this about this shared housing part of it. And so if I can just go through that and have people give me your opinions and all that stuff, that'd be great. So let me just put this. So when we're talking shared housing at that point, we're talking in a lot of cases, it's usually an ownership issue. If there's a rental issue, that's a little bit less complicated for DDS in the state. But when there's an ownership issue, that then becomes more, I won't say problematic, it becomes more complex. There'll be a single owner, so one family decides that they're going to buy something for their son or daughter, and then another person will become a roommate with them. Another concept is they have shared ownership, that there may be a couple of families that buy a house, and then in some cases it becomes a limited liability corporation, an LLC. So as we're looking at this issue, I'm looking at the issue of when it becomes there's an ownership piece to it. Because when there's an owner from somebody, a family, we then get into what's called related party, a related party transaction. And because they own it and their individual receives money from DDS, we have to make sure that the rent is a fair rent. And we have to make sure that how the state dollars is done in a way that people aren't making money off of a housing situation that they've developed. I've got into this a number of times with families and say, I want to buy the house across the street. It's a rental house, and I want to charge $2,000 a month because that's what the owner did before. Well, the issue becomes if you're going to take rent subsidy now, it's now a related party issue. So you can't make money off of the state by that. What the state will do is pay you your actual cost. So they'll pay you for your mortgage, they'll pay you for the depreciation, they'll pay you for the utilities, and that can all be part of the rent. But that has to have a cost to it. There can't be a profit piece to it. And this sometimes is that piece then becomes complicated, and trying to work that out with families starts becoming an issue. We had one case where a family member wanted to add an addition onto their house, and so that their individual could live there. Sounds great. Then they wanted to charge that individual rent, and looked around and saw what other apartments were getting, and were then wanted to then charge, I think it was somewhere around $2,500 a month. And we then had to say that you own the house already, what were your costs and how do you break that down? And was got very insulted that we were even asking these questions. So this shared housing has this complexity to it. And as you get into this shared housing piece, then the whole part of occupancy comes in. And all this stuff is because if you're getting money from DDS from the housing subsidy. So when you're looking at the occupancy, and so now you have a family, and some of these situations we've had, there's 4 families that got together, and 2 of them owned the house. They were agreed with the other 2. Then one of the individuals decided to leave, and then the restrictions that were being put on who else could live there, which is fine. They have some of that piece to it, but in terms of once the individual's in, and then they say, well, they're causing too much problems, so we need to kick them out because of this. Then DDS gets involved and all of a sudden becomes this mediator. Whereas if it's a separate rental, we don't have a say in terms of that stuff. We'll still talk with the families and stuff, but in terms of this, it becomes, who decides who lives there, who decides when someone has to leave, the whole mediation process. What's the mediation process if something goes bad? Because DDS is a lot of times has been in the middle of it. With these situations, you also need to be looking at a lease. They all have to have a lease. And what are the rules for leasing the property? How much is the rent? And who's responsible for the various expenses? We had one case that came in that there were 2 individuals in the house, and then the third person comes in, and the 2 individuals, their parents owned the house. So the third person comes in, and all of a sudden they wanted to charge that third person more rent than the other 2. And we ended up having to go round and round in terms of, you can do that as long as you don't have DDS rent subsidy. But if you have rent subsidy, we're looking at that individual who's coming in and saying, this is the cost of the house, and this is how much DDS will pay for that. So there's a lot of dispute resolutions if you don't have a lease. The other piece that you look at then is, what are the supports? How are the supports made up? Are they shared supports? And so you may have one individual that comes in who has a significant higher budget than another person. And it all works until that person leaves. Then all of a sudden the person takes a big chunk of money out. So now there's less supports in that house. And then they start coming back to DDS saying that person now needs additional dollars. And DDS then gets in the middle of this. So, we have to look at, how the money's built in terms of the shared supports, and making sure that it's something that's going to last, that it's not something that works for this particular situation, but once it ends, people start coming back to DDS and saying, we need additional dollars, and because we bought this and you approved it, you now have to pay us this. So it's just another complexity that we have to look at when we look at these shared housing situations. And then when you're looking at the staffing, who is doing the staffing? These aren't CLAs, these aren't CRSs. So most of the individuals coming in are coming in with individualized home supports. So they have supports that are coming for the individual. Now we've made that a little bit simpler now that we have the 2-to-1 and 3-to-1 IHS rates. So now that kind of helps in terms of some of these situations. But still the money is per person. So each individual has their own funding. They have to figure out how staffing schedules are decided, how is this all working? Are there shared staffing responsibilities? So does the family members, are they involved? Is it all, if there's 3 staff for 3 individuals and they come at separate times, or does somebody come in the morning and work with 2 of the individuals and somebody comes in the afternoon? I mean, all these things need to get spelled out as you're looking at one of these shared housing responsibilities. and supervision becomes an issue. How do you know the staff is actually doing a good job? And whose responsibility is it for the supervision? And if there's any disciplinary issues, who takes that on? So those are some of the complexities. They're not all, but there are things that need to be looked at as we look at these shared housing situations. Michael?
Michael Beloff, parent and agency board member. And I think you're right, Peter. It is complicated. And I think one of the things that really complicates it is because there's not a lot of information for parents beforehand. What happens is parents are saying, well, we have to find a solution for our kid. We don't know what DDS is going to provide. So let's think about how we would do it. And they're the people with the least knowledge of what the pieces are that need to be put together. If there were guidelines, and all we need to do is break the guidelines into two parts. One part of the guideline is how to set up the brick and mortar. So families understand how ownership should be structured, what they can charge, how it works, so that because the challenge it sounds like you've run into is families have set up a system and then try to shove it into a DDS guideline. And what it should be is, here are the DDS guidelines, design what you're going to do around this, so that parents don't feel like they're being blindsided when they put this wonderful, what they thought was a wonderful plan together, and then it's not going to work either now or some point in the future. In some ways, the brick and mortar, in my mind, is the easy part, because it's easy to set guidelines that are fairly standard based on the number of individuals in a house and what subsidies might be. Certainly, the harder guidelines are going to be around supports, because there's going to be much more diversity in supports than there will be around a one-person home, a two-person home, a three-person home. That brick and mortar part, which is what the families tend to focus on, is probably going to be much more regimented and easier to design guidelines for families to start thinking about as they're gathering their resources. From the support standpoint, that's the piece that the families probably haven't really thought through, because when they're living at home, the family's providing those supports and they're not really monetizing what the value is. I think for there, we need maybe some more flexible guidelines. And here are the things that need to be thought of, especially if the needs of the individuals are radically different. It sounds like the way, especially with some of the issues you're describing, when there are different budgets for supports and the supports that are needed, that's when things get a little wonky, especially if there's going to be a change in house membership. And I think that's what families should be encouraged to think about as they're finding their friends who may have very different support needs, even though they're friends, in terms of putting a residential situation together. And again, if we have guidelines that the families can look at in designing this, I think it'll make problems for DDS. They won't go away, because there'll always be issues, but we'll go from problems like this to problems like this.
Well, and that's a good point, because I'm going to share my screen. So hold on, because we don't have the support piece, but we do have the other piece. So hold on, let me see if I can find it. Where'd you go? Hold on. I'm trying to find it. Hold on. Oh, hold on. Trying to share. It's not doing a good job sharing. Why aren't you there? Where are you? I wish I was good at this. I can't, for some reason it's not showing up. I don't know why, but we have guidelines for related party ownership for homes. And I'll send a copy to everybody. So that kind of does a lot of the bricks and mortar piece that you were talking about. I think that the support piece, I think, is an interesting concept as to how to do that. I think that's something that the department should probably take a look at and say, guidelines and stuff. I know when I look at these, any of these all have to go through the ethics committee. And when it goes to the ethics committee, one of the things, and I was on the ethics committees for years, one of the things I would always look at is, because this is a Medicaid system, it's designed that everything needs to be as fair as possible, transparent, open. And that having an individual whose parents have the means to be able to buy a house and find the supports for them, or build a house for them, and they have a place to go, and then look for DDS to give a break in terms of, we want X, Y, Z because of this. I always go back to the individual who doesn't have those resources and what, those supports to make sure that they get what they need as well. And how do you balance that need and stuff? So I think that support piece that you're talking about, how that gets set up, I think would be probably a valuable thing, putting these two pieces together. Here's the bricks and mortar, and here's the support piece that you need to understand what they are and stuff. So Shannon?
Very quickly, I mean, I think in terms of what you're talking about, that equity piece, if people have access to a housing subsidy and they want to get an apartment, then you don't need to necessarily buy a house, And so I think figuring out how people can share wherever they live is important. But a couple of things. I think Michael's point about the guidelines is spot on. I think that you need to have information for people up front. And that even goes for like right now around housing subsidies. I just went through a situation where somebody is moving from a CLA to self-direction, and they're looking for apartments. And I felt like the information was given to them in such a piecemeal way, where if there were something that people got up front that lays things out for them, that helps them to understand the process and the things that they're going to need to do, I think that really goes a long way. Because a lot of times, like with the shared living, people say it's so easy. Well, it's not easy. It's very complex. And people need to understand that up front, and that there's a lot of responsibility that they're going to have in this process, that it isn't just DDS figuring things out, that here's what you're going to need to do. And then the other thing I will say is that it is another case where having an independent support broker involved, I think, is super helpful, because they can help people to navigate that and put all of these pieces together. And so, just my 2 cents.
Thank you.
This is Keith Lavalette, DDS. We are at the end of our meeting time. Our next meeting is scheduled for 4/4/2023. And can I get a motion to adjourn? Win? A second?
I'll make the motion, but I want to ask a question first.
All right, go ahead.
How can I follow up, and with whom, on shared living?
We are in the process of hiring a housing director. And I know they're working through that. So that's going to be the person who will be the point person for the shared housing piece of it. In the meantime, if you want, you can probably call me.
Okay.
And if I don't know it, I'll direct you to whoever at that point is doing what you're looking for.
Okay, that is great. Thank you very much. I make a motion to adjourn the meeting.
Second.
All right. Thank you, everybody, and we'll see you on April 4th. Take care. Bye.
Bye, everybody.